Hi, my name is Emma, and today I'm going to tell you about COVID-19 testing. COVID-19 is a virus that affects mammals, including humans. The COVID-19 virus spreads when someone talks or exhales. When the germs from one person's breath gets on another person's body, that person might touch their face. If the person does touch their face, those germs are going to go to the lungs and start destroying the lung cells. Some symptoms to realize this might actually be happening to you are tiredness, dry cough, runny nose, diarrhea, aches, pain, sore throat, and having a difficult time breathing. Now, of course, I can't actually do a test for COVID-19, but what I can do is teach and explain it and give an example of using a demonstration. I'll explain step by step what the doctors do and use. In order for a doctor to do a test for COVID-19, they need very specific tools. Those tools are a person to test, a nasal swab, a little tube, polymerase and reverse transcriptase, primers and nucleotides, and an RT-PCR machine. The first step is that the doctor will stick a nasal swab up the patient's nose and get some cells. Then they put the cells in a tube. Next, they get the RNA and DNA out of the cells. Finally, they put the tube in a PCR machine. In the RT-PCR machine, the RNA will be converted to DNA with reverse transcriptase. Then primers will stick to the DNA. The DNA polymerase will connect the nucleotides to the primers, creating a double-stranded DNA. Next, the temperature is raised so that the DNA separates into two pieces. This cycle repeats about 30 times, creating millions of identical DNA strands. Here is a video of me giving a demonstration of an RT-PCR test. So here we have our cell with its DNA. When the virus comes, it attaches to the cell and it injects its RNA. First, we break apart the cells to get out DNA and coronavirus RNA. Then we add primers, nucleotides, and reverse transcriptase, which will add nucleotides to the DNA primer, creating a DNA strand from the virus RNA. Then we repeat the process with DNA primers and DNA polymerase to create a complementary strand of DNA. The temperature is increased to separate the two strands of DNA. Then the cycle repeats over and over, doubling the number of DNA strands each time. I hope you like my video on coronavirus testing. Thank you. Finally, you test the tube to see if there are many duplicates of DNA. If there is, that person has officially been tested positive for COVID-19. I hope you liked my explanation of COVID-19 testing. Thank you.